This is the posterior view of the right scapula, and how I know it's the posterior scapula is because of this spine. It's huge, right? And the spine, posterolateral, has the acromion process, also huge. So below the spine of scapula, you have the infraspinous fossa. So this would be your lateral border. This would be your medial border of the right scapula, posterior view. This is the inferior angle. On the side, or lateral view, you can see the glenoid cavity, or glenoid fossa, and that's right in here. This is an anterior view, and here you could see the coracoid process, which is anterior. You could see this fossa, which is called the subscapular fossa. Then above here you have your suprascapular notch. That's just that notch right here. Right? And above the top fossa, above the scapula, is called the supraspinous fossa. This is the clavicle, which you see it has kind of a sharp edge on one side, medial, and this would be your sternal end, and a more blunt side on the opposite side, which is going lateral. So sternal end is medial, articulating with the sternum to form the sternoclavicular joint. On the lateral side, you have the acromial end, because that's going to articulate to make the acromioclavicular joint, the AC joint. So that's the clavicle, and that's really the only things you really need to know. I won't ask you right or left. So again, the sternal end of the clavicle, sharper. The acromial end of clavicle, which is more blunt looking. This is an anterior humerus, and if you look, the medial part of the humerus, proximal, is the humeral head. And right in front, you can see this, I don't know if this is so clear on this recording, but this is the lesser tubercle, which is lateral to the humeral head. And the lateralmost part is the greater tubercle. And there's an intertubercular sulcus as well, right there. And along the shaft, you have the deltoid tuberosity. So this would be an anterior humerus. And this would be the lateral part of the humerus. And it's got this round process or protrusion called the capitulum. That's lateral. It's going to articulate with the radial head to make up the elbow. And then the trochlea is more medial. That's shaped like a bow tie. And this process right here would be your medial epicondyle, and then you have your lateral epicondyle. So the capitulum you're not going to see on the posterior view, which you'll see. And then there's a fossa right above the trochlea, and that's called the coronoid fossa, because it's going to articulate with the humerus through the trochlea anteriorly. Posterior, distal, you don't see the capitulum anymore. You just see the trochlea and this huge fossa. It's much bigger than the one in the anterior, and this is called the olecranon fossa of the humerus. So let me see if I can get a better view. Olecranon fossa, you can see, versus the coronoid fossa, which again, it's kind of hard to see with this blanching of this light. So if I can get a close-up of that for you, there you go. You can see that roundish capitulum there, like right here. And this is the trochlea. This is the coronoid fossa. This is the medial epicondyle. Key parts for the humerus. This is the ulna, and the ulna kind of looks like a wrench, doesn't it? It has like a wrench look to it. So this little fossa here, or it's a notch actually, is called the trochlear notch. This posterior part is called the olecranon, or the olecranon process. And that has an anterior part. Well, it's not really anterior, it's always posterior, but this is the part of the olecranon that's going to articulate in the olecranon fossa of the posterior distal humerus. This is the coronoid process that's going to articulate anteriorly with the distal humerus. And this is the radial notch, just an area of articulation for the radius. The distal ulna has a medial. Now, the ulna is medial to the radius. So the distal ulna has a styloid process and a head. So the styloid process will form an articulation with the carpals medially. This is the radius. See if I can clear this up for you. And you can see the head of the radius. Kind of looks like a nail head. Let's see if I can get a close-up of that. So this is going to articulate laterally with the capitulum anterior of the distal humerus. So this is the radial head. And distal on the radius, you have the radial styloid process. So this is the radius, which radiates around the ulna. And this is in the anatomical position. This is lateral. This is the proximal head articulating with the elbow. And down here, you have that articulation with the scaphoid of the carpals. And the outside part of the radius and the wrist is the radial styloid process.